like an acquired brain injury slash spinal cord injury symposium for professionals. Some of it's going to include a lot of like medical jargon and probably a really good review from anatomy and neuro classes. But there's also going to be stuff in there like yoga for the neurologic populations, qigong, things like that. So I'm excited about those parts. If not, it's just going to be a really long weekend. So it is a little bit different. It's Saturday and Sunday. I usually only work Tuesday to Friday with my outpatient schedule. So I'm only going to have one day off this weekend, and I'm not sure how I feel about that, but I know it's for the better, and I know I'm going to learn or relearn lots of good bits of information, and a lot of my coworkers are going to be there presenting on various things or helping out with the event or just attending because they want to learn too. So anyways, I'm on my way there right now. Woke up at about 6, got ready, went through Duncan because it's going to be a long couple days, and just wanted to have something interesting to keep me awake in case I start to feel tired. It's just after 7 right now. I need to be there by like 7:55-ish, so ETA like 7:30, 7:25, so should have plenty of time to get there, get oriented, and probably mingle with the other resident because I haven't seen him in a couple months. So follow me along to see what is going to go on at the symposium. Just made it to my work's parking garage and walking up now.
In rats, is that there's a connection between these. We're able to get flow. Now, again, this is just.
Yeah, you go to the website, here's all the information on it. Or, for example, in a couple of weeks.
Hi there, how are you? Good. Are you familiar with Entity's mini enema?
I'm not.
Okay, well what it is, it's obviously a mini enema. It's nice and tiny.
So when we're talking about inserting that catheter going the wrong way, 1800. How are you?
Good, how are you?
Good. Where do you work? Oh,
I'm
here.
outpatient. Yep.
Okay, perfect.
I want to talk about the similarities between stroke and
through this program to increase their week.
Hi guys, just finished up day 1 of the symposium. I've been here for 11 hours-ish. Time to head home. Did not know they'd be feeding us both lunch and dinner. Otherwise, I definitely would not have brought my lunch. Gotta stop at PetSmart and then we'll get ready for tomorrow. So just to give you guys a little reflection on what we learned today at the symposium, it was a lot of lecturing, and then there were some times where there were a couple things going on at once. So for example, during one time slot, it was like a speech therapy thing, and then the other half was a qigong class, which was really fun, my first time doing that. But in the lectures, a review of the latest literature. So one of the main points was like, it's possible to regain motor function in motor complete spinal cord injuries, so Asia A and B. And they said that the biggest factor for whether or not the patient regained motor function or whether or not the epidural stimulation worked is basically the placement of it. Had nothing to do with the chronicity or the type of injury, but the majority of the patients were able to regain motor function in, I think, up to 6 lower extremity joints. May have been upper extremity too, I don't remember. They even got a lot of the patients up and walking. However, there was only one functional community ambulator, but nonetheless, it's still really cool to see. They also discussed how the majority of the deaths related to severe brain injuries within the first, I guess, 72 hours of injury was due to the withdrawal of life-saving therapy interventions, so, like maintaining airways, things like that. And with that, they basically just talked about how within those first 72 hours, it's too early to even tell what sort of progress the patients are going to make. So, why have that discussion of prognosis when the patient is not even showing any signs of consciousness? And the speaker was very passionate about it, which made it an excellent speech. And then we had some of my coworkers talking about different types of technologies we use in rehab. This specific lecture was on ideas for combining various pieces of technology with one another and how that will increase the therapeutic benefit and also, I guess, just help to generalize the treatment a little bit, make it a bit more functional. There was also a lecture about spinal cord recovery. Specifically, they studied it in 2 different types of mice, and there's one type of mouse, I think it's like the spiny mouse or something like that, where their spinal cords or their central nervous systems in general regenerate a lot faster than what is typical in humans or in other mammalian species. So they just basically compared the 2. And then we had a lecture on the pediatric population and how to work with those little guys who have suffered from some sort of a brain injury or spinal cord injury. And that's definitely one population I don't really have experience with. So that was really interesting. And then some of my coworkers also talked about high intensity gait training and just in general how going back to our neuroplasticity principles, just really talking about the importance of getting that intensity factor when treating patients with neurologic injuries, because that in itself is going to lead to more functional gains using various methods like treadmill versus functional training versus stairs, or even changing the direction and having the patient do like lateral walking, backwards walking, as long as they were within an appropriate heart rate range in order to get them to that recommended intensity of about 70% heart rate max, they said it was. So going back to epidural stimulation for those with motor complete spinal cord injuries, that is pretty much just the latest clinical trials. It's not commercially available yet, but it's super exciting nonetheless, and I'm looking forward to the days when maybe some of the patients I'll be seeing with spinal cord injuries have epidural stimulation and are able to regain some joint movement. And then going back to the mouse study, they said that some of the factors that influence the central nervous system growth were that in typical mice, they had significantly more scar tissue in the spinal cord after it was injured, more inflammation, as well as just increased inhibition overall for that potential for regeneration. So they just looked at various mechanisms for that, and that's what they found. So then tying that mouse research back into humans, there's been some studies on, it's similar to blood flow restriction, where they can expose those with spinal cord injuries. I'm not sure if they've done it in humans yet, but I know that they are doing them on rats, where they expose them to hypoxic events to see what kind of effects that has on central nervous system regeneration, as well as hypothermic states, and there were a few others I can't remember, but just things like that, trying to see how they could influence the regeneration of the spinal cord in that instance. Something else I thought was super interesting is that there's, I forget what they call it, I don't know if it was brain mind-body interface or like brain-computer interface, something like that. But basically when someone has a brain injury, that communication is disrupted, where the body and the mind can't communicate as well as it used to whatever extent that looks like, and how there's a company called Neuralink. I partnered with Elon Musk, which I didn't know, that's kind of crazy, crazy cool, but how they partnered with Elon Musk to use that technology in the patients and see what kind of effects that had. And it is fairly new. Again, I don't think it's commercially available, so they don't really know like what sort of long-term effects it's gonna have, or how the technology will degrade over time potentially, or how, because it's like a pronged device that sticks into the brain, so they don't know if that would create scar tissue and then potentially disrupt some pathways, just things like that. But like I said, it's a new thing they're trying. Alright guys, got home not too long ago, took the boys for a walk, as in the dogs, I do not have human children. Alright guys, got home not too long ago, took the dogs for a walk, and got ready for bed. So I think I'm gonna go ahead and turn in. It's like 8:50, but I have to wake up early tomorrow again for the second day of the symposium, and I'm tired and I am full from all the food they fed us. So I'll see you guys tomorrow. Follow along for part 2.